One day, Reese was doing pull-ups at the gym when suddenly his stomach hurt, and he had no idea why. So he decided to go to the hospital. Hi Reese, I'm Dr. Conor, and this is my med student Randy here to describe to you what a hernia is.
A hernia is... I sound so
Dr.
sick.
Randy, what's a hernia?
A hernia is the bulging of the organ or the tissue.
Alright Reese, here's Nurse Carly to describe to you where your hernia is.
So there's a part of your intestines protruding in your right lower quadrant called a hernia.
While we're on the subject, could you describe to me other terms used to describe areas of the body?
Yes, I can, Dr. Malarkey. In the right half of the abdominopelvic region is the epigastric region. The right hypochondriac region. The right lumbar region. And the right iliac region. And in the left abdominopelvic is the left hypochondria region, the umbilical region, which is in the middle, the left lumbar region, and the left iliac region, which is sort of by the hips.
And don't forget to use his right and his left, not your right and your left. My med student and I are here to give you a better understanding of your hernia's location. Your hernia is inferior or below your heart, while also being superior or towards your head than your hips. Since we discovered your hernia rather late, my assistant Carly is going to explain to you the treatment you will need. Alright Reese, my assistant Carly here is going to explain to you the treatment you will need for your hernia.
Okay, Reese, we are going to make an incision in your axial skeleton, which includes your head, your neck, and your trunk, to be more specific. The cut will be in your right side of the abdomen, medial, or closer to the middle, to the bladder, while also being lateral or farther from the midline than the kidneys.
Elaborate on what Nurse Carly said. The cut will be superficial or towards the body surface than the skin surface, but also being deep or away from the body surface than the blood. Randy, my med student Randy, will now explain the symptoms of the surgery.
Alright, Reese, so after your surgery, you're going to feel some soreness. Other symptoms I'm not exactly sure of.
I will describe that for you. You will feel soreness in your thighs, distal or farther from the attachment to the hips, but also being proximal or closer to the attachment to the knee caps. This pain will last a couple weeks, and the anterior or front of the body to the rectum. Welcome back to your second appointment, Reese. How are you feeling? Pertaining to the other day, all of your appendicular skeleton, which consists of your limbs, you will feel pain, and this is because your muscles will be weak, and you also feel numbness from the surgery on the posterior or back side of your body. And also your dorsal body, which consists of your cranial, spinal cavity, which will recover after the damage, which will help to recover after the damage. The cranial cavity, which is made up of your brain and your skull, all trigger the immune system to help heal the wound. And now here's Nurse Carly to explain your other x-rays that we will use on you.
To further examine your hernia, we will use x-rays to examine your abdominopelvic cavity, which contains all the organs in your abdomen and your pelvis. The x-rays will show us a frontal plane view, or anterior and posterior of your body. Connor, now explain to Reese what other x-rays we will use.
Thank you, Nurse Carly. We will also be x-raying your sagittal plane, which divides the body into a right and left parts. Also, we will be x-raying your transverse plane, which divides the body into superior and anterior sides. And finally, we will the x-raying your body mid-sagittal, in the mid-sagittal plane, which is a sagittal plane but cut down the midline.
That's all I'm saying? Thank you, Dr. Malarkey.
You're welcome, Nurse Carly. And now Nurse Carly will tell you what you'll expect for your next visit on November 9th.
Okay. Before you leave, Reese, your ventral body cavity, which contains all your internal organs, anterior to the dorsal cavity checkup, is on November 9th. Oh, and I almost forgot, Reese. Your thoracic cavity contains organs superior to your abdominal, pelvic, heart, and lungs. Just for a fun fact. Bye.
Goodbye, Reese. Give us an A.